want to talk about the history of women in healthcare and some important figures who broke down the barrier and entered medicine and how that led to healthcare today. Throughout history, women have been denied the ability to enter and practice medicine. Women were allowed to find work in sick nursing or midwifery, but discoveries during the Renaissance threatened the position of women in medicine. Women were unable to join professional guilds, making it increasingly difficult for them to find work in medically related fields. Men pushed women out of the majority of their roles with the exception of limited nursing practice. It was not until nursing gained importance during the Crimean War of 1853 that women began to regain positions in the medical world. Since then, numerous women have worked to force their way into roles in medicine and healthcare.
For as long as women have been banned from medicine, women have been trying to break into it. One spectacularly early example comes from 4th century BCE in Athens. Being a female doctor was considered a capital crime in Athens during the time that Aditi wanted to practice medicine. Even knowing that she could be executed for attempting to be a physician, Aditi made the choice to attend school in Alexandria and study medicine. When she returned to Athens, she posed as a man in order to practice medicine. She specialized in gynecology and became extremely successful as women realized she wasn't actually a man and sought her out for help during childbirth. Her success as a physician drew the attention of Athens' men, who accused her of seducing the city's women, not knowing that she was a woman herself. When it was revealed that she was a woman, her accusers aimed to execute her, but then were stopped by a number of the women whom Aditi had treated. Athenian law was changed shortly thereafter to allow women to be seen by female physicians. A more modern example of women trying to break into medicine comes from an Irish military surgeon named Margaret Ann Bulkeley. She, like Aditi, posed as a man, using the pseudonym James Barry. Over the course of time that Barry lived as a man, she became the medical inspector for the British colony of Cape Town in 1815, became an inspector general of hospitals in 1831, and performed one of the earliest successful C-sections. Her actions as a doctor were strongly oriented towards public health and proper treatment not just for soldiers, but also prisoners and soldiers' families.
Elizabeth Blackwell was admitted to the Geneva College of Medicine in the mid-1800s. The dean of the medical school let students decide whether or not to admit her, and they voted in her favor as a joke. Blackwell was the very first woman to earn a medical degree in the United States. She went abroad to work in medical clinics in Paris and London before opening her own practice in New York City. She founded the New York Infirmary for Women and Children in 1857. Blackwell acknowledged the difficulties that women face and the need for education for females in her books, Medicine as a Profession for Women and Address on the Medical Education for Women. As one of the first females to break into the male-dominated field of medicine, she specifically helped provide opportunities to attend medical college and engage in internships for other females looking to become doctors. Blackwell continued to support the pioneering woman following in her footsteps by opening another medical college in London specifically for females. Mary Putnam Jacobi was a writer of political essays and fiction stories, as well as an esteemed physician. She published over 120 scientific papers and 9 books. She earned degrees from the New York College of Pharmacy and the Female Medical College of Pennsylvania in the mid-1800s. Putnam began practicing medicine at the New England Hospital for Women and Children before gaining additional medical training in Paris. Putnam was outspoken about gender discrimination in the workplace and passionately supported joint education of men and women, as women's medical programs did not provide training equal to what men received. Putnam founded and led the Association for the Advancement of the Medical Education of Women to further her cause for co-education of the genders. As a lecturer at a women's medical college, she worked to improve standards of education for women. She won the Boylston Prize from Harvard for her argument that women are not physically limited compared to men, which she supported with data and statistics obtained from her evaluations of women's health. Her other accomplishments include becoming the first female member of the Academy of Medicine and founding the Women's Medical Association of New York City and the New York Infirmary's Children's Ward.
Another important woman in medicine was Mary Walker, who was the first female surgeon. She attended Syracuse Medical College in 1855 as the only woman in her class, despite ridicule from her contemporaries. She was granted the Medal of Honor for working as an assistant surgeon in the Civil War in 1865, and was the only woman to have done this. During the war, she was held captive as a prisoner, and after she was released, the Army put her in charge of a women's prison hospital in Kentucky. She was a women's rights activist and supported the dress reform and women's suffrage. She wore trousers every day and wore suit and top hat to her wedding and kept her last name, which was a big step for women of her time. Clara Barton was known for helping soldiers during the Civil War. She brought supplies like food and clothing to wounded and sick soldiers and would write letters for them, listen to their problems, and prayed with them. She convinced the government and army to allow her to assist on the battlefield and served in important battles such as Harper's Ferry, Antietam, Fredericksburg, and Charleston. She started the organization of the Office of Correspondence with Friends of the Missing Men of the United States Army and identified over 22,000 missing men. Her biggest achievement was founding the American Red Cross in 1882, which aided in international relief by sending help to Russia and other places.
Rebecca Lee Crumpler was known as the first African American female doctor. At the age of 21, she was a nurse in Massachusetts, and when she was 29, the year was 1860, she decided to go to medical school, and the New England Female Medical College accepted her. She graduated 4 years later in 1864. She wrote a book titled A Book of Medical Discourses in 2 parts, which was published in 1883. The first part was about infant gastrointestinal problems and what caused some of those problems and how to heal those problems. The second part was about problems women and children face and how to heal them. In modern times, there's been an increase in females in the health field. It is shown that women doctors are more skilled in preventative care from a study published in 2009. However, in some areas of the health field, males still dominate the field. According to the Association of American Medical Colleges, during the 2013 to 2014 year, 46% of people applying to medical school are female. In the 2013 to 2014 report, 71% of pediatrics residents are women, 83% of OBGYN residents are women, 43% of internal medicine residents are women, and only 38% of residents in surgery and emergency medicine are women. In the 2013 to 2014 report, it is seen that the number of full-time female faculty in medical school only went up by 8% from a decade ago, from 30% in 2003 to 2004 to 38%, and males went down from 70% to 62%. The number of deans who are women went up 6% from 2003 to 2004 to 2013 to 2014, from 10% to 16%. And for department chairs, it went up 5%, from 10% to 15%.